Good afternoon.
Hello, everybody.
We're tuning in from Cobb Valley Animal Clinic because we're waiting on Dr. Mann. She's going to be talking about seasonal allergies. So we're just waiting on her. We'll wait for you guys to come in and think of your questions and comments that you want to ask her. If she does not have time to answer them right away, just type them and she'll respond to them later at the end of the broadcast. So,
Right.
I'm Brittany.
And I'm Ashley.
I'm the office manager, and this is Ashley. She's our
Food manager, if you have any food questions.
nutritional specialist.
Yes.
So just give us a call if you have any questions. This broadcast will be available all the time. You can watch it anytime and replay or call or come by and ask us questions. This is a new thing that we're doing here. It's just to educate everybody, and I know everybody doesn't have time to necessarily call us, so if you have a question that you've thought about and maybe we can answer it, or you can send us an email or a comment and we can answer it for you.
What she said.
We are just waiting on her. She's awesome. She's our new, well, she's not new, but she is actually our
Medical director.
Yeah, she's our medical director.
Yeah.
She's awesome, and you guys will love her. We have 4 doctors on staff here, and they're all awesome. They're just amazing. Last week was Dr. Carr, and she was doing heartworm awareness.
Right.
And so she gave some information about that. And so at the end of this broadcast, we may have some free stuff for you. So just stay tuned, and we may be able to give you something free.
Exactly. Again, guys, if you're just joining us, Dr. Mann will be answering your questions here shortly. So if you have any itching questions,
She's waited her whole life to say that.
I really have. If you have any questions about allergies this season, now is the time to ask, or you can call us. We are always standing by until 6:30.
Monday through Friday.
Monday through Friday, Saturdays as well.
From 8 to 2.
8 to 2. As well as the doctors rotate.
How would they know that?
Again, if you're just joining us, Dr. Mann is going to be answering your questions very soon.
Yes.
Yes.
Oh, hey, Miss Singer.
Hello, Miss Singer.
How's the crew?
Hopefully good. Hopefully
Aw,
doing well.
I miss you.
Aw.
I hope everybody's doing well.
Yes.
You'll get to talk to Dr. Mann soon. She'll be in just a little bit. She had a patient to treat.
Yes. Dr. Mann always giving it her best.
Her
Always.
all the time.
Always. Always.
Good. I'm glad. We everybody ready for summer?
Summer, spring. Is it spring now?
You
Is
gotta
it
come
summer?
by and bring me some pictures of the baby so I can see them.
Yes. Send us pictures of their new babies and old babies and all kinds
No.
of fur babies.
We are. What? Wait. When is it?
What?
No, summer's not. It's not summer yet.
Well, it feels like summer.
It
might
feels
as
like
well
summer,
be.
but it's technically not summer yet. But it feels
Exactly.
like it. It's typical Alabama weather.
Typical Alabama weather. Typical Alabama spring. I'm not entirely.
We don't have one.
We don't have one. We just kind of skipped it.
We are going to. If you guys have any ideas or comments that you would like to have as a topic for our next couple of weeks, please feel free to send them in, and we will talk about those. I sent one of Misty.
And her Easter.
Oh, you did? Where did you send it to? I don't think I saw it. Misty and her Easter.
Oh,
That's so
I bet
cute.
she's precious.
She's adorable.
Yes. Oh. I think we still have that delay that's happening. So y'all, if y'all do ask questions, don't feel alarmed or think we're ignoring you. We do have a delay in the broadcast. So, but we will try
10
to answer
seconds?
them. Yes, 10 seconds. So there is a 10-second delay. So don't think we're ignoring you. And like Brittany said earlier, once the broadcast ends, we will answer your questions in the comments.
I don't think I saw it. I will check it as soon as we get done with our broadcast, because I have to see that little baby in her Easter dress. Did anybody else dress up for Easter? Because all of your babies are adorable. They're so cute. They're so cute. I tried to put a sweater on my cat, and did not go over too well. She was not having it. She just sat there like she was being shocked. But is Dr. Mann coming in?
She'll be here shortly. She's wrapping up her appointment in the next room.
She's wrapping up right now, so Dr. Mann will be in shortly. I know you guys are tuning in and you're like, that's not Dr. Mann. But, you know, she's coming. Soon.
Soon.
Ashley, is there anything food-wise for allergies that you would like to talk about?
Well, some food that we do sell on the shelves right now that is for allergies and sensitivities and skin. You'll find Hills has one called DD. Comes in different flavors. Maybe you have some pets that are on it. If not, and you're interested, feel free to call up here and I'll be more than happy to help you guys out. As far as others, there's various medication for allergies that probably could be best for your dog. Maybe if you want to ask on your next vet visit. I mean, I'm trying to think. Like,
is there, so like a allergy? What does that mean? Like the food? What do you mean by allergy?
Well, a lot of times we'll have a few clients. I'm sure you might be one of them whose pet cannot have certain ingredients like chicken and all the other delicious stuff that's out there. Basically, it's a bummer, but we have various formulas that are designed specifically for pets who cannot have certain kinds of foods.
Even vegetarian.
Right, like there's so many. There are, I'm trying to think, multiple ways you can find out if your dog is allergic to something.
The allergy test?
The allergy test.
And you'll get a scale of everything that your pet is allergic to. And
right.
It's crazy to see. I think there was one pet that was allergic to houseflies.
Yes.
You would never think about anybody really being allergic to houseflies.
Oh, you know what blew my mind is how there's some pets that are allergic to grass.
Yes.
Like that.
Certain grasses.
I mean, Alabama, right? Like, we are surrounded by grass.
Pavement.
Pavement, you know, all Alabama the beautiful. Other than that, allergies can come in all kinds of shapes. And, well, wait a minute.
There's a knock at the door.
We have a knock at the door.
I wonder who it is. It better be Dr. Mann. Let's see who it is. We're going to have the lovely Dr. Mann. We're going to change over just a little bit, and it's going to be the lovely Dr. Mann.
And our medical director
It's nice talking to you guys.
Hi,
Here she
everybody.
is.
Sorry for the delay. I'm just going to go through some kind of common questions about allergies today. Do I need to look at you or
Either way. You're fine, whichever way.
All right, so welcome to our Lunch and Learn. Hopefully everybody's doing well. So this time of year is a really problematic time for allergies. So I want y'all just to kind of, listen to what we have to say, and then if you have any other questions, just chime in anytime, and we'll get back to you as soon as we can.
Someone had a question about itchy paws.
Yes. Okay.
Like
What
her
does that
dog's
mean?
paws were itchy and what she could do to relieve
to kinda
that.
help with that. Okay. Well, just to give y'all a background, so allergies are caused by just an overreaction of your immune system to an allergen. And so some of the things that they can be allergic to are fleas, food, and the one we're really going to focus on today is the environment. Something in the environment that causes, a lot of itching. So for instance, the foot licking is probably because there's a reaction to the grass or something in the environment, but it could be something that's indoors. So a lot of environmental allergies are seasonal, but some environmental allergies, which the condition is called atopy, some of those will be year-round because if the dog, say, is allergic to house dust mites, they can have that year-round. So it really needs, to have kind of a conversation with your vet, to come in, to look at the pet and kind of decide, just kind of get a good history. But so they're very common allergies. We see it a lot in this area. We just have such a long, warm season here that a lot of these problems are very long-term. Dogs that have allergies, cats too, usually start having problems between ages 1 and 3. And it can happen, though, in any breed. Purebred, mixed breeds, very, very common, really, in anybody. But we do see a lot of I'd say English Bulldogs and Westies. Those are really, like, if you see one of those breeds, you almost need to have, like, a conversation initially about, you need to look for these things because they're very common.
Ears.
Their little ears and
pitiful.
everything. So some of the symptoms that you'll see with allergies, a lot of it depends on what type of allergy. So if it's a flea allergy, for instance, a lot of times the dog will be chewing right above their tail. With food allergies, they can have facial rubbing around their mouth, they can have ear infections, and they can also rub kind of around their kind of booty area back there. So it's kind of interesting. That's another reason you really need a good exam and a history, you know, to figure out kind of where you need to guide, you know, what you need to do. But with atopy or seasonal allergies, you're going to see a lot of the foot licking, chewing, a lot of times the lower half of their body, on their bellies, kind of in their kind of thigh areas, armpit areas. Those are classic for little hot spots and just for irritation. You'll sometimes smell an odor. A lot of these dogs and cats get secondary infections, so you need to treat with other, you know, therapies instead of just like an antihistamine. They may need antibiotics. Yeah, you're getting a good rundown. So sometimes you can't manage these things easily, but
would you recommend the allergy test that we have?
That is an option, and I'll talk a little bit more about some of the treatments, but that is definitely a way to find out what they're allergic to. I'm a big fan of doing the test because you can actually determine, you know, if it's a food allergy or an environmental allergy or seasonal type allergy to see what they're allergic to and how badly they're allergic to it. You get a ranking of 0 to 6. 6 being like ridiculously high and 0 being they're not allergic at all.
Okay.
But now with cats, I'll talk briefly about cats. They're a little different from dogs. They're going to have more of like the wheezing and kind of more respiratory. Dogs really don't get respiratory symptoms from allergies.
I didn't know that.
And then cats, really, they'll scratch at their head and their face a lot, kind of around their ears and their eyes.
Yeah, like above their little eyes.
Right here, and they'll have all these little scabby, it almost feels like seeds, and it's like a little dermatitis from that. Beautiful. So that's classic. If you feel any little bumps kind of that feel like scabs on their face, that's probably from an allergy.
Huh.
So some of the, do you want to talk about treatments now? We can talk about some of the options. So
yeah, for sure.
A lot of it depends on what they are allergic to and how the severity of it is, but we usually start kind of for milder allergies with two things. We're going to recommend a shampooing regimen, which would be either a medicated shampoo if there is a secondary infection, or even just like an aloe and oatmeal type shampoo, just a really, you know, soothing, you know, something like that, maybe at least once a week to help wash off the allergens, you know, from the skin. And then the other one would be an antihistamine. Okay. And there's a bunch of different ones that are over the counter, and we can discuss doses of that kind of as needed, but a lot of dogs, though, they're going to need something stronger than an antihistamine. So that's where the prescriptions come in. And so in the past, all we had was steroids, right? That was kind of like the only option.
The go-to.
Right. The go-to. But now we're fortunate to have other safer and less side effect ridden options. So we have Apoquel, which is like
it's a miracle,
a miracle drug.
It's really a miracle drug. I'd say about 85 to 90% of our dogs that are on it really do have a drastic reduction in their itching and chewing and licking and all that. We have a new injection. It's called monoclonal antibody therapy that we just received in the last month.
Oh, cool.
It's a once-a-month injection that's supposed to reduce itching. It actually binds to the allergens and prevents the itching.
That's awesome.
So that's something you can ask about too.
How often would they have to get that?
They start them off at once a month,
okay.
and some of them you can go to every 6 weeks, just depending on when the itching comes back.
Well, yeah, that's super
convenient. Get them redone. So that's an option. The allergy testing is something that you can do, and then from that test you can do what's called hyposensitization, which is like a vaccine. You give them a low dose of the allergens that they're allergic to and give them an injection of that.
Awesome.
We've had variable success with that. We, a lot of times we'll do other things, but that is an option. So there's a lot of options. I guess one thing that's very important though, y'all, for allergies is there's no cure. It's a management thing. It's something we can manage the symptoms, and we can manage kind of some of the issues with that, but it's not. You have to have an expectation that a lot of times, as long as those allergens are present in the environment or in the food, or if they have a flea on them, they're going to continue to itch. So that's why a lot of these therapies are very, very important.
Oh yeah, often.
You got to keep them on it for a while.
A pet that has never had allergies, could it like grow into getting allergies, or
yes,
is it just...
the immune system is a weird thing. Usually they are fairly young when it starts, but I think more and more we're seeing older dogs and cats that develop allergies. Like Buddy Turner, he has his allergies.
His little paws.
He was like 9, when
he got his.
Mm-hmm.
Are there always, I mean, would you say that they always start the same? Like beginning symptoms, like can you tell right off that, that's...
You usually can.
Yeah.
If it's environmental and there's something that they're in contact with, whether it's grass, it's usually pretty obvious. But sometimes it's hard to know because they can look,
perfectly fine.
It could be food or other things. So you just have to really kind of do some trial and error sometimes.
There was a question about a puppy that had like little whelps on its tummy that had water like inside of them.
Like a little blister, a little pimple or something.
Someone inquired about it this morning. Would that be an allergy, or is that...
If it's a fairly young puppy and the puppy is not itching or seems to be bothered by it, that's probably something called puppy acne or puppy pyoderma. That's usually something they grow out of with their immune system maturing and everything. So that's usually not considered an allergy unless they are, scratching and licking. Because usually those bumps come up without anything. Because usually the bumps that you see on their skin is from... It's kind of a chicken or the egg. Did the bumps come up first and then they got itchy, or did they itch and the bumps come up because they're itching? But usually with these little puppies, it's not because they're itching. They just come up. So that's probably something that dog will grow out of, hopefully. But that would be a good one to do the shampoo. One of the medicated shampoos, like Malachite or something, and that would, kind of help with it.
Soothe it a little bit.
Exactly.
Aww.
Exactly. So anything else?
Because we have questions all the time about allergies.
A lot of food. I know, like the food allergies.
Right.
And,
food allergies like that. Are a major.
Grain. Oh yeah. What would be your recommendation? We get a lot of questions about the all natural foods.
Right.
Things like that. About would you have a brand that you would always recommend to somebody, or would you tell them to shop at like Walmart or PetSmart or anything like that?
There's so many options now. It's very overwhelming. Doing a food trial to figure out if it's a food allergy, it doesn't have to be a certain brand, but the key is to find a novel protein that your dog or cat has never eaten. So if they've been on chicken and rice for their whole lives, they may have developed a sensitivity to that. It could be the grain or the protein. A lot of times everyone wants to blame the wheat or the corn. It can be the protein. It can be chicken. It can be beef.
That's good to know.
It could be lamb. But if they've been on chicken and rice, we would say, well, let's try duck and potatoes. Totally, or venison and potatoes.
Venison and potatoes, salmon, all
salmon or something like that. I mean, they make like rabbit and kangaroo diets even. That's kind of just very out there that if they're going to have a reaction to their other food, I doubt they would with that. So if they've been on that food for 4 or 6 weeks and they still have not shown any improvement, then there's probably another, like an environmental factor at hand too. So.
Chelsea, she has a 6-month-old puppy and he started sneezing quite often.
Okay.
He doesn't seem overly itchy though. Is this an allergy?
It's probably.
Thank you for your question, Chelsea.
That's a good question. There could be a little inhaled irritant or something, but it's probably not the same kind of allergies we're talking about. Usually dogs, it's going to be in their skin. And they can certainly sometimes get runny eyes and a little bit of a sneeze, but I don't know what breed this little puppy is. If it's a Shih Tzu or a little kind of smush-nosed, brachycephalic type dog, it could be related to that. But hopefully the dog would grow out of something like that. Right. But they can try like a little Benadryl or something to see. It's 1 milligram per pound every 8 hours or 12 hours. And you could try that first and see if that helps with the sneezing.
Oh, that's cool. Thank you, Chelsea.
Yeah,
I hope that
Good
answers.
question.
Give us a call if you have any more questions. We're happy to answer.
Absolutely. Sure. Absolutely.
As far as... she said it was a yellow lab.
It's a yellow lab. Okay, so not a breed that would be
really prone
have
to
trouble
it,
for prone to it. So he may have gotten into some dusty, you know,
like
some
anything.
dust or something like that, and he's just got to clear all that.
Yeah.
So I would probably just, you know, as long as it's not just, you know, constant, you know, he'll probably clear whatever it is.
Should
I
an
doubt it's an
allergy treatment, should it go untreated? Like if it's itching, like an animal is
is it just gonna
itching,
go away
will
over
it go
time?
away over time, or should they definitely come in?
Right, that's a great question. So some animals will scratch a lot, but you'll never really see any changes in the hair coat or the skin itself. And so those, it's more of a nuisance than anything. But the problem is most of these are going to have changes to the skin, because when you chew and scratch, you're going to make little breaks in the skin, and the bacteria that normally lives on the surface is going to get into the skin, and it's going to set up shop. So you're going to get, you know, little bacterial, little staph infections, and those become more itchy, right? And so then it's like a vicious cycle, so that these dogs that are having redness or bumps, hair loss, things like that, they usually need something, you know, not something done
Definitely.
to alleviate that. So,
Cool.
yeah.
Well, we have so many questions.
Oh, I know.
This is very,
it's so
popular.
We could talk for literally hours about allergies. There's no, like, it's every case is different. So we're happy to kind of address those individual
Benadryl,
questions.
we get a lot of questions about Benadryl.
Right,
And
yes.
Claritin.
Milligram per pound, the Claritin
What
is
is
another one.
a medication like the Benadryl? I know they have different types of Claritin, like
Right.
it has this something to make you sleepy and like
Right.
different, and they have eye drops, all kinds of stuff.
Yeah, so antihistamine eye drops are fine for a little bit of a red, runny eye. If it doesn't get better though in a couple of days, definitely they need to come in. Or if they're winking at you, they're really sensitive to the light, they need to come in. They may have an ulcer
Definitely.
or an infection that needs antibiotics. But as far as Claritin goes, it's very safe as long as it doesn't have the Sudafed in it. So it doesn't need to be the D, just the
okay.
plain,
Good to know.
plain loratadine or Claritin, the generics loratadine.
Yes.
And we'll give you the dose. Kind of, it's kind of depends on the size, obviously, of the dog. And we can give you that dose. It's a little bit easier. You only have to give it once a day usually. Big dog twice a day.
Okay.
But it works sometimes.
And it doesn't make them drowsy because
It usually
Benadryl
doesn't.
usually.
Same for cats. Same for cats also, right? You can use. Can you use that as like you would a dog?
pill the cat?
I was about to say. For the drops.
Cats hate Benadryl, y'all. Benadryl and cats, it's really bitter tasting, and they really do not like it.
Not a fan.
So
Not a fan.
there are some antihistamines you can do for cats, but you know, for the most part, we, you know, sometimes need to do an injection of something, you know, like a steroid. You know, cats, unfortunately, you can't give Apoquel. It's not labeled for cats.
All right.
There's been some use of it, but we do have more, unfortunately, more limited options in cats. But you know, that's one thing. You got to check them really closely for fleas first, and make sure. Talk about food options, trying a different food, and kind of get some.
Which is what I mean. I guess that topical preventative that we sell for cats. Would that cover? Like I know,
like a front line.
like a front line or
Advantage Multi.
Advantage or
Advantage
Revolution.
Multi. Revolution's excellent for, especially if your cat
Love
goes
that.
outside at all. If you do Advantage Multi or Revolution, you're covering fleas, heartworms,
the whole
and
like
internal
a huge
parasites.
spectrum.
And it's not that much more expensive than just doing something that's just for fleas. So that's a good option too. So.
Well,
anything else?
yeah, like we said, I guess if you have any questions after this
Just
broadcast,
call us or send us a question on Facebook, and we'll get back to you.
All right. Well, awesome.
Thank you guys so much for
Thank
your
you guys for
questions.
tuning in. Next
Yeah.
Wednesday, Lunch and Learn.
Lunch and learn.
All right.
Bye.
Bye.